Hello, I'm Chief Strazo of the Brunswick Hills Fire Department. Thank you for watching today's episode of Fire Alarm. In this episode, our crews will be showing you our emergency medical services equipment and be discussing how we provide high-quality patient care to the residents of the township. This is Fire Alarm.
So my name is Michael Eberl. I'm a firefighter paramedic with the Brunswick Hills Township Fire Department. I've been on the department for almost 4 years now, maybe 5 years. And I'm going to sit here and discuss what it takes to become a paramedic for our department or any department in Northern Ohio. So we start as an EMT basic, and that program is roughly 5 months long and takes $1,500. And then when you're done with that one, you can start working as an EMT and do some cool stuff, get some cool experience. But ultimately everybody wants to be a medic because being a medic is pretty cool. So you start the medic program with an anatomy class that is $1,000, and that's about a month and a half long. And then that rolls right into your medic program, which is the hardest, most impossible year of your life that you will ever spend doing something. But it's totally worth it. There's another $5,000 with that one. And like I said, it takes a year. You're in class a few times a week. You have labs to do. You have ride time to do. You have clinical experience to gain. So you are exposed to everything that you will be working on as a paramedic when you graduate and pass your test. Paramedic is more advanced than an EMT basic, and we get to put those skills that we spend a year learning to the test on a semi-regular basis. You know, we can start IVs, we can push meds, we can start airways, we can direct CPR, we can run codes from, you know, little kids, babies, all the way up to, you know, geriatric patients. And you know, we have a lot more training and skill. We can interpret 12 lead EKGs and talk to docs. Docs can talk to us and let us know what they want us to do. So there's a lot of responsibility riding on our shoulders. So with over a year and a half worth of schooling and all the books and all the knowledge that gets crammed into our brains, you're probably wondering, how do we keep it all straight? First, we practice on a daily basis. We're always training. We're always talking about calls. We're always running through scenarios with each other. But if we ever get to a scenario where we haven't been in for a while, we've got our protocol book. So it's kind of like a little choose your own adventure, I guess you could call it. You know, we can open the book and it tells us different sections, you know, airway and breathing, shock and circulation, obstetrics, you know. So in each of these sections there's different, it breaks it down into different medical emergencies. And you know, if we haven't running something for a little while, or something's not making sense to us that we're seeing with our patient, we can consult the protocol guide. It's a backup. It's another set of hands almost that just doesn't talk to us. So we can run through this handy dandy little flow chart, and it tells us, you know, hey dummy, remember this, think of that, and start looking at stuff. And then it kind of guides us through. So you go from starting at the top with the airway, breathing, circulation, and then off you go into whatever that emergency might be. We also have a huge section here with our medications, because we do have a lot of meds in our drug boxes. And if we have a moment where we need to figure out what a dosage is, or there's some drugs that we can use for multiple emergencies, but they're different dosages, we can look that up and make sure that we're giving the right dose for the right emergency. So this is kind of cumbersome to wield. Obviously, it's a big book and you don't want to be flipping through pages. So in the ever-growing popularity of electronics, we have the E version of this, which is really cool because you can call it up, and then it's just a matter of touching what you want to hit. And then as you go through it, you can touch the box. It'll take you to the drug if it's a drug, and then you can look at it and figure out, okay, now I need to give this drug at this dose. And then just because I have the drug pulled out and I know that I've got it from the drug box with the protocol book doesn't mean that I can give it right away. We still have to verify with our partner, that we're giving the right dose, the right drug, the right patient. And then we just monitor and continue to monitor the patient to see if they improve. And then if we need to repeat the dose, same, pain meds, cardiac meds, blood pressure medications, there's all kinds of things that we can do back here.
Hi, my name is Braden. I've been with the department for about 3 years, about a year and a couple months full-time. I started part-time. I have wanted to do this for a very long time. I got into it a little bit later in life. I actually went the college route first and started out as a mental health therapist. Did that for about 5 years, and it just didn't feel like the right fit. So when they say like a job's a calling, that's kind of how I feel with this job. It kind of always kept pulling me back, and I just said, I was 32 and I said I got to go back, and I went back to fire school and went through EMT school first, and then got my paramedic certification, and here I am. Here at the department, I help Mike with EMS, and I'm also on the Medina County First Team, which is the mental health support, I guess, for the county. So any department that goes through a tragedy or just needs extra support after a tough call, they can call an all hazards team, which is the Medina County First Team, and we can come out and debrief with the team. I also am like the liaison for our EAP program, so our Employee Assistance Program here at Brunswick Hills. So as a Brunswick Hills employee, you get free EAP benefits, meaning you and your family could have counseling. You could, there's also like, if you want to make a will, budgeting, like healthy options for working out and recipes, stuff like that. They have a whole website. So that's all free as an employee of the township. So I'm kind of the liaison for the company that we work with, and then getting people connected if they feel like they need counseling. So the training for the Medina County First Team, it was an application process, and it's a relatively newer team that there's definitely a need for in just first responding, the first responding community. So you have to go through pretty much I think it's ICSM training. It was a 3 or 4 day training, where we learned all about the different techniques that we could use. So depending on obviously the incident, so if it was a mass casualty event, or even the death of a pediatric, we can come out for stuff like that. The team will kind of round up people who are appropriate for the situation, and then we would come out and debrief with the team. I think kind of the old regime back in the day was kind of like don't ask, don't tell when it comes to like just your mental health, your overall wellness. But I think as time has kind of gone on, and we've realized that like the suicide rates for first responders are high, and the job doesn't stop. So you may have a really traumatic call, but your 24-hour shift isn't over. You might just be hour 2 into it. And you have to keep going like that call was, either didn't happen, or just taking that on every call with you. So it's important to kind of debrief that stuff and talk about it. And I know some people are more apt to talk, and helps them. Some people don't, but it's good to know that you have people that have either experienced what you have, or at least you have the support, the option, and you're not going to be ostracized for just bringing it up or talking about it, or a lot of people back in the day, the saying "man up." It just doesn't do any good. It doesn't do any good for the department morale. It doesn't do any good for the actual person and the person's family, because we have to remember these guys go back to a family. They have kids, wives, husbands. So it's just healthier to talk about it and know that you have the support, bring it to light. We love the community of Brunswick Hills, and I think they like us. We have a lot of good community support. So thank you for that. We appreciate that. We couldn't do this job without you or for you. So yeah, everybody here just loves what they do, and if you need us, call us.
All right, so I talked about what it takes to become a paramedic. Now we'll show you what our office looks like. So all these doors and everything open different compartments, and the different compartments have all of our extra equipment. So we have a Lucas device. I'll get to that in a little while. We have a pediatric bag, our drug box, mass casualty tags, an extra oxygen tank, extra cot batteries, extra Lucas batteries. In this compartment, we have our various stretchers, our various backboards, our Reeves stretcher, our stair chair, our vacuum splints, so we can lay this out, put your arm or leg in it, suck the air out of it, and it becomes a pretty good cast. We have C-collars, and then we call them mega movers. It's just a big tarp that's a little stronger than a sheet. So if we have to lift somebody up and they don't require a stretcher or a backboard, we can pick them up with that, and it gives us flexibility to kind of move them around a little bit. So this compartment has our air packs. So we have 2 air packs for the driver and the officer, and we can keep our gear in here. And this is for when we go onto a fire scene as a backup squad. We can be tasked to go into the fire and assist with that if needed. So like I said, we can go into we show up on a scene. We may be the squad that shows up, and we get tasked with assisting the fire crew, or the command will say, hey, we want you guys grab that line. You're going to go in and do a primary search, or no, we've got a casualty. We want you guys to take this casualty and transport them. So we always have to be ready to go. And speaking of being ready to go, nobody likes talking about it, but we all have the news, and we've seen the school shootings and the mass casualty events. So we're always ready for that as well. So we have our tactical gear, which consists of a helmet, a vest, and then a little quick medic bag. This is strictly bleeding control and gunshots. So it's walk in, we find a person, we slap a seal on them, we may do a needle decompression, we slap tourniquets on, and get them from the X to a safe spot. And then we also have our tools. So if we get to a house and we can't get into the house because it's locked or somebody's trapped inside, we've got our Halligan tool and the axe that we can use to pry and pop doors open. And this compartment's pretty boring. So there's nothing exciting in here. Our big oxygen tank for the truck, and another gear compartment storage area for our third guy. Which brings me to how many people are on the squad. So on a normal day, we'll have 3 guys. We're all medics. Almost all of us are medics. We'll have the driver, the officer, and then the medic sitting in the back. But lately we've been splitting 2 and 2. So we'll ride 2 guys in the front, 2 guys in another squad. And if we need to, if the call's serious enough, we can extra set of hands jump in and help each other out. So the front seat we have, just like any other car, you get in, you start it up, and away you go. But because we go do cool stuff, we have cool stuff to help us get there. So we've got a control panel that has our emergency lights on it. We have floodlights on the left, right, in front of the vehicle to help us if it's dark outside when we get to a scene. We have some extra light. We've got a radio that we can contact dispatch or other fire units. And we also have a little public address system as well as our siren. So this is the inside of the squad where all the magic happens, if you will. Looks like there's a lot of room, right? Well, stand by and I'll show you how tight it gets. So now we have the cot inside and just myself. But if we had a patient on here, our second guy or our third guy, you can tell that it gets really crowded. And if there's a lot of stuff going on with this patient, it gets really busy. But because we're all well trained and we work together on a fairly regular basis, it's like a very well-oiled machine when everything gets rocking and rolling in here. So we don't really trip over each other a whole lot. We've got one guy that's in charge and the other guys are the hands doing things. So now we'll talk about specific equipment that we have in the back of the squad that allows us to do what we do. So we'll jump outside and I'll show you that. So this is some of the equipment that we get to use while we're on a call. We have our drug box that has all our medications in it. So we can give something as simple as an albuterol treatment to something as complex as blood pressure medication, or if somebody's having a diabetic emergency, we've got glucagon, we have epinephrine, we have Narcan. For overdoses, we have medications that can reverse various poisonings or intoxications from chemicals. We have baby aspirin. There's all kinds of things in here that we get to use. Probably one of the coolest inventions after the mechanical cot, the electric cot, is our extra set of hands. So we've got our third guy here, or our fourth guy. This is our Lucas device. It's a hands-free CPR machine. So the patient goes in, we click them into the board, we turn it on, we pull this down, and then the machine does the compressions for us. So now we have 2 sets of hands, 3 sets of hands that can do all the other interventions that are required during a cardiac arrest. We have our monitor, which will show us all the vital signs, everything that's going on with the patient. We can do 12-lead EKG that's just as good as the one that you get at the hospital. We can defibrillate, we can convert rhythms, and we can transmit everything that we're seeing to the hospital. And then our coolest little gizmo here is our cot. So gone are the days when you have to manually squeeze levers and lift things up and push them down and pick people up. This saves our backs so we can work longer and smarter. And then our ever-present jump bag. This is our first line piece of equipment that we take into a house because it gets us the basic, we get the basic blood pressure, see what the blood glucose is doing, and your oxygen levels. And if we know that that's all good and you've got a little too close to your chainsaw that morning, we can stop bleeding with some bandages. And if the bandages aren't enough to stop the bleeding, then we've got some more serious stuff. We've got the tourniquets, the quick clot, pressure dressings, and then onto our airway. So like I said, we can intubate. We have what's called an iGel. This is a blind insertion airway device. Basically, we just take this, slap it in. It occludes the esophagus and allows us to get air right into the lungs. So we don't really have to think a whole lot about it. It's a rapid intervention that we can do. And then we also have our handle and blade and our standard tubes like you would see on your favorite TV show. The bottom line in all of this is that we can do an awful lot of things that you can do at the emergency room. There's just fewer of us that do it. When you call us for transport, we show up to the house, we pick you up, load you on our cot, secure you for transport. load you in the back of the squad, do whatever we're going to do intervention wise initially on the scene, and then off we go. We can transport in town. There's 2 hospitals here in town, Cleveland Clinic, Brunswick, or Southwest Emergency Department. And then the 2 big ones that we transport to also would be the Southwest General Main down there in Bagley Road in Middleburg Heights, or Cleveland Clinic Medina. And if it warrants, if it's serious enough, we can also go downtown to the bigger level 1 trauma centers downtown. Calling 911 doesn't necessarily mean that you're going to go to the front of the line when you get to the hospital. It all depends. You know, we triage you when we get you, and we call the hospital and we let them know this is what we're bringing in. When we get you to the hospital, based on what we have with you and all the other patients that they may have in the emergency department, they may say, well, you know what, you're a lower acuity than this person, so you're going to wait, or we may take you out front. So that doesn't necessarily mean that you're going to get a room right away. So again, my name is Mike Eberl, and on behalf of the guys that work in the department here at Brunswick Hills Township, I want to thank you for tuning into this week's episode of Fire Alarm.
Hey everybody, Fire Inspector Tom over at Brunswick Hills with today's safety tip. We want to make sure that you have a home safety escape plan, and this is a fun activity you can do with the kids, do with the grandkids, but should always have 2 ways out of your home. So if you have a first floor bedroom, you can't get out the hallway to the doors, or the back door or the front door, try to get over to an open window. If you're on the 2nd floor and can't get down the stairs, make sure you make your way over to an open window. If you're below grade, you really shouldn't be sleeping down there unless you have a special escape window. Those are very difficult places for us to rescue from. But always practice 2 ways out, talk with your family about it. Any questions, give me a call, I'm happy to help. Bye-bye now.
Thank you for watching this episode of Fire Alarm. We hope you tune in for our next episode when we discuss fire suppression and rescue operations.
Thank you for watching Fire Alarm. The next episode will be available in 2 weeks.